Avatrombopag is the newest thrombopoietin receptor agonist to achieve approval for immune thrombocytopenia. Unlike Eltrombopag, it doesn't require dietary restrictions, it doesn't chelate iron, it doesn't have hepatic toxicity, a signal for hepatic toxicity, it doesn't have some of the other rarer side effects like changing the color of bodily fluids and things like that. So it's felt by many patients to be a more convenient option, but it's only approved for chronic immune thrombocytopenia, patients who have ITP for longer than 12 months. So this study that we did, that we presented here at ASH, evaluated patients who we treated with early immune thrombocytopenia, newly diagnosed within the first 3 months or persistent from months 3 to 12, so within the first year. And in those patients, our hypothesis was that it would be the same, it would be the similar efficacy, similar safety, all of that. And that's exactly what we found. Okay, so, whether it was early ITP or chronic ITP, the drug was highly effective in improving the platelet counts. Both groups had very low incidences of any sort of significant bleeding. And really, the drug was quite safe. There were no venous thromboembolic events in the early patients, and only one in the chronic patients, for an event rate per 100 patient years that's really quite low, lower than we saw in the clinical trials of Avatrombopag and ITP. So to date, the largest real-world study of this drug in ITP with some very nice findings.